And joining us in studio is Dr. Erica. She's here to talk about fatty liver disease. And a lot of people don't know about this, but you were mentioning before we came back that it affects a lot of people.
It does. About 1 in 3 Americans in the United States is estimated to have fatty liver disease, and you may not have even heard of it. And so what we're talking about today is fatty liver disease that's not associated with alcohol use.
Okay.
So this is not the heavy alcohol use liver disease we're talking about. This is primarily the body depositing fat in the liver and then the health problems that people get from that. So when the body deposits fat in the liver, it's called non-alcoholic fatty liver disease. Usually there's no symptoms. There may be no changes on their laboratory studies. We often just find it incidentally when we're looking at ultrasound or CT for some other reason. So we identify that. The dangerous part is that about 20% of those people with fatty liver disease progress to what we call Nash, or non-alcoholic steatohepatitis. And the difference is that that fatty liver now has become inflamed and irritated. And this is when you may see elevation in the liver function tests. You may need to get a liver biopsy for further information. And then this Nash can progress in about a quarter of patients to full-on cirrhosis, which is liver failure, which is scarring, which is irreversible. And we are estimating that by the year 2030, which is really only 12 years from now, Nash is going to be the #1 cause of liver transplant, or leading to liver transplant. So a lot of people have this fatty liver disease. I see it a lot in clinic, and people don't realize the dangerous consequences that can develop from it. So its risk factors are going to be obesity, diabetes, elevated cholesterol, and the best thing that you can do is try to prevent those risk factors. So diet and exercise, weight loss is paramount if you find that you have any fatty liver disease, to try to reverse it and prevent it from progressing to Nash, and then also preventing any other insults to the liver. So making sure that you are immunized against hepatitis, or that you haven't been infected with a hepatitis virus that you're unaware of, avoiding alcohol, avoiding Tylenol products and other medicines that can be harmful to the liver, and making sure with your primary care provider or a GI doctor that you don't have any other cause of liver disease. And the interesting thing people often like too is that 3 to 4 cups of black coffee a day may help. Now, this isn't coffee with sugar and creamer, and it's not even espresso. It's something about drip caffeinated black coffee that may help prevent progression, or maybe help reverse some of this fatty liver disease, along with diet and exercise and weight loss and all of that. So
the coffee is good news. If you're up this early, you're probably a coffee drinker, so that does help. Great.
Exactly.
Well, thanks so much for the information. We really appreciate it.
Yep.
All right, and we have national headlines coming up after the break here on Montana This Morning.